So, patients commonly ask me, what is my procedure that I call a SculptLift that we trademarked many years ago. SculptLift is a type of facelift technique that I developed many years ago where we tighten not only the skin, we tighten that muscle layer under the skin. And when we do that, we take out some of the tissue under the skin. It's called SMAS, S-M-A-S. That layer stands for superficial muscular aponeurotic system. That layer, a very collagen-rich material, we can take it, instead of throwing it away, we can put it back into the face and help fill up those areas that the typical facelift may not completely fix. If we do a conservative facelift and we don't pull somebody tight as a drum, we're not going to get rid of these folds here and here. They're not going to they're going to get better. They're going to get definitely better with a conventional lift that I'm talking about doing. But it may not get rid of these folds totally. And so you can take some of this tissue and instead of throwing it away, you can use it as a filler and put it back into these folds here and here, and even into the lips to plump those areas up. And so that's my quote SculptLift procedure. And I developed it many, many years ago. I've been doing this technique for over 20 years. And the nice thing about it is these patients look good 10 or 15 or 20 years later. Now they're not going to look as young as they did right after the lift, but they won't look bizarre. They don't look like they've had something done. And that's a big fear for a lot of my patients, is that they're scared that as they continue to age, they're going to have to do something, otherwise they're going to look strange. And that's not the case with this technique. I've been watching these patients, I've been following them for years, and they really still look natural many, many years later. And that's one of the things that I like about this particular technique.